Welcome! In this video we will speak about nematodes. At the beginning we will briefly mention typical properties of nematodes and then we will go into more details of each particular parasite. So, nematodes or roundworms. What is their body structure? What we should know about how they are organized? Their body is not divided for segments. It is of cylindrical shape. It is covered with cuticle and body cavity is filled with fluid that serves as hydroskeleton and also participates in metabolism. Digestive system of nematodes is shaped as a tube and they have buccal cavity, esophagus, intestine and anus. The nervous system represented by nerve ring, nervous trunks, dorsal and ventral, and transverse commissures. Circulatory system is absent as well as respiratory system. Reproductive system, they have separate sexes, meaning they are not hermaphrodites. There are separate males and females organisms. And typically male worms are much smaller than female. They may be geohelminths, meaning that eggs and larvae develop in external environment, for example in the soil, or they may be biohelminths, that means that development occurs with alteration of hosts, where some organisms will be intermediate hosts and another organisms will be definitive hosts. However, there is at least one tricky parasite for which intermediate host and definitive host can be represented by the same organism. If we will briefly go through classification, nematodes related to phylum Nemathelminths, class Nematoda. Inside of this class, species that we should know are Ascaris lumbricoides, Enterobius vermicularis, Trichocephalus trichiurus, Ancylostoma duodenale, Necator Americanus, Strongyloides stersoralis, Trichinella spiralis, and Dracunculus medinensis. Ascaris lumbricoides. Geographical distribution of this parasite is worldwide. Here you may see schematic illustration of the female worm and male worm. And this is schematic and artistic illustration of the egg containing larvae. Please note that adult worm may produce 240,000 eggs per day. Amazing number. Disease that is caused by Ascaris lumbricoides is anthropognosis. This means that human is the source of infection. And at the same time, flies and cockroaches are mechanical vectors of the disease. Life cycle. Not mature eggs released from the organism of the host with fecal material, and then this fecal material will be transferred into the soil where not mature eggs should mature into mature eggs. In case if temperature of the soil is between 24 and 37 degrees, maturation of the eggs in the soil takes approximately 3 weeks, but in lower temperature, maturation of the eggs in the soil may take much longer. And eggs may survive in the soil for 10 years. Infection of human occurs due to ingestion of eggs through contaminated hands, food, water, vegetables. When egg appear inside of the intestine, larvae or immature form of the parasite will be released from the eggs and then transferred into the blood. From the blood, larvae will migrate inside of the lungs, and from the lungs through bronchial tree, through trachea, larvae will migrate further into esophagus and from esophagus inside of the gastrointestinal system. So they start from intestine, go through the blood, lungs, esophagus and came back into the intestine. This migration lasts approximately 14 to 15 days, and larvae becomes mature later in the small intestine, approximately in 2 or 3 months. And lifespan of the mature worm is approximately 1 year. Pathogenicity of Ascaris lumbricoides associated with allergy, toxic damage, and mechanical injury. During pulmonary stage may be present such symptoms as cough, pain of the chest, also may appear urticarial rash. During intestinal stage may appear such symptoms as vomiting, abdominal pain, diarrhea, headache, intestinal obstruction, and even perforation of the intestine that is extremely dangerous may lead to peritonitis and even death of the patient. Also may happen mechanical jaundice due to bile ducts block. Diagnosis of Ascaris lumbricoides. Microscopic examination of fecal material should be done for identification of the eggs. But it is important to keep in mind that eggs will not appear during the first months of infection, and also if only male worms are present in the infected human. Increased number of white blood cells, called eosinophils, may be suggestive for Helminth's infection, but at the same time it is not specific for Ascaris lumbricoides. Another way to diagnose this parasite is detection of antibodies against Ascaris lumbricoides in the blood. In order to prevent this problem, it is important to make washing hands, to wash fruits and vegetables and boil the water. Now let's speak about another parasite that is called Trichiurus trichiura. Geographical distribution is worldwide, and here you may see a schematic illustration of the female and male forms of this parasite, as well as schematic illustration of the egg containing larva. Disease that is caused by Trichiurus trichiura is anthraponosis. Let's imagine that this is a soil with not mature egg. What will happen next? Next, this egg in the soil will mature, and this maturation will take approximately 25 to 30 days if temperature is approximately between 25 and 40 degrees Celsius. And eggs may survive in the soil for 3 years. Ingestion of eggs through contaminated hands, food, water, vegetables will lead to infection of the person. When this happens, inside of the small intestine will appear larvae, and these immature larvae will migrate inside of the villi of the intestine for development. And after some period of development inside of the intestinal villi, that takes approximately 3 to 10 days, larvae will come back inside of the intestine, and there it will give rise to adult worm in 30-35 days. Adult worms of Trichiurus trichiura may survive inside of the human body approximately 3 to 5 years, unfortunately. Pathogenicity of Trichiurus trichiura associated with allergy, toxic damage, mechanical injury. And for intestine, there may be abdominal pain, appendicitis, chronic intestinal bleeding, and even anemia. In order to diagnose Trichiurus trichiura, microscopic examination of fecal material for identification of the eggs should be performed, and to prevent it is important again to wash hands, to wash fruits and vegetables, to boil the water. Now let's speak about Enterobius vermicularis or pinworm. Its geographical distribution is worldwide. It is again anthropognosis, and here you may see a schematic illustration of the male and female of this parasite. Ingestion of eggs will lead to infection of the human, and then larvae will appear inside of the intestine. There, larvae will be transformed into adult worm during approximately 2 weeks, and after this, adult worm will migrate through the intestine, and fertilized females will migrate through the anus at night and lay eggs on the skin of perianal region. Eggs will mature and become infective during 4 to 6 hours being laid in the perianal region. It is an important point, so they not have to be transferred into the soil for maturation. They may mature already on the skin in the perianal region. Lifespan of the adult worm is approximately a month, but reinfection that will sustain disease is possible. Pathogenicity of Enterobius vermicularis is associated with allergy, toxic damage, and mechanical injury. Symptoms may be itching and skin inflammation in the perianal region, abdominal pain, appendicitis. Diagnosis is based on examination of fecal material for identifications of the eggs. Identifications of the eggs in perianal scraping taken in the morning before the bath, and this is important in order to increase probability that eggs will be identified. In order to prevent this pathology, it is important to follow personal hygiene, and also it is important to treat infected family members. Now let's speak about Ancylostoma duodenale. Here you may see schematic illustration of the mature worm, larva, and egg. Adult worm may produce 25,000 of eggs per day, quite a big number. Now let's speak about life cycle of Ancylostoma duodenale. Eggs will be released with fecal material and then will be transferred into the soil, where they will give rise to immature form of the parasite larva. Larvae may survive in the soil for several weeks, and then they will be able to enter human body via skin penetration. Another way of infection is ingestion. For example, ingestion may happen due to drinking of contaminated water, fruits, vegetables. What Ancylostoma duodenale larva will do after penetration through the skin? It will migrate through the blood circulation into the lungs, and then further through bronchial tree and trachea into esophagus, and from esophagus into the gastrointestinal system. There, larvae of Ancylostoma duodenale inside of the intestine will give rise to adult worm, and the lifespan of the adult worm is approximately 2 to 5 years. Inside of the human body may be from 100 to 1000 worms. Pathogenicity of Ancylostoma duodenale is associated with the fact that it is hematophage, meaning that Ancylostoma duodenale is able to make sucking of the blood, and also Ancylostoma duodenale produce anticoagulant that may support further bleeding even when sucking of the blood was terminated. Of course, in severe cases, this may lead to anemia. Also, pathogenicity of Ancylostoma duodenale is associated with allergy, toxic damage, and mechanical injury. Diagnosis of this parasite performed on the basis of microscopic examination of fecal material that is done for identification of the eggs. Prevention. It is important not to walk barefoot And also it is important, as in previous cases, to wash fruits and vegetables and treat patients, because infected patient is the source of infection. Necator Americanus. Its life cycle, pathogenicity, diagnosis and prevention is very similar with Ancylostoma duodenale, so we will not go into the details of this, and will switch our attention to next parasite that is called Strongyloides stersoralis or Threadworm. Life cycle of Strongyloides stersoralis will be described in these slides. Larvae, and this is important to focus attention on, not eggs, but larvae will be released with fecal material, and then inside of the soil, initial immature larvae will be transformed into also immature but kind of more advanced form of the larva that will be infectious. And then this infectious larvae may infect human via skin penetration, and this may happen during contact with contaminated soil. After skin penetration, larvae will migrate through blood circulation inside of the lungs, then through the bronchial tree and trachea it will migrate into esophagus, and from the esophagus it will go into gastrointestinal system. And there, inside of the intestine, larvae will be transformed into an adult worm. Then adult worm will produce eggs, and eggs will give rise of infectious larvae inside of the intestine. And this is a very important point that distinguishes this parasite from others that we discussed before. In case of previously discussed parasites, it was important for immature form to go through certain stage of maturation outside of the human body. But this parasite, it has possibility to generate eggs and form infectious larvae from the egg directly inside of the human body. And then this infectious larva will migrate through blood circulation again into the lungs, and from the lungs, next portions of the larvae will migrate through bronchial tree, through trachea, into esophagus, and then again inside of the intestine, and this round from intestine into the lungs and from lungs into the intestine may happen again and again and again. Let's summarize it step by step. Inside of the intestine, eggs will give rise to larvae. Then larvae will migrate from the intestine through the blood into the lungs. Then larvae will migrate from the lungs into esophagus. Then from esophagus into the intestine. In the intestine, larvae will be transformed into the adult worm. Adult worm will produce eggs inside of the intestine, and all this cycle will happen again and again and again. Such cycle may lead to problem that disease will be maintained for 30 or 40 years. And this may happen because eggs will not be released with fecal material, and instead of this they are able to generate larvae inside of the host. So inside of the host may happen kind of all life cycle of the parasite. Inside of the human body will be produced eggs, then from eggs will be generated larvae, then from larvae will be generated adult worms, and adult worms will generate new eggs with new larvae and new adult worm, and so on, unfortunately. Pathogenicity of Strongyloides stersoralis. Skin symptoms may be represented by dermatitis, swelling, itching. Symptoms associated with pulmonary migration of Strongyloides stersoralis may be represented by wheezing, coughing, and pneumonia-like symptoms. Clinical symptoms associated with the presence of parasites inside of the intestine may be represented by vomiting, diarrhea, constipation, abdominal pain. Microscopic examination of fecal material should be done for identification of the larvae, not eggs, but larvae. In order to prevent this pathology, it is important to protect the skin from the contact with contaminated soil. Now let's speak about Trichinella spiralis. On this schematic illustration you may see how female parasite looks like. Here you may see schematic illustration of the male parasite and larvae. Intermediate host and definitive host of Trichinella spiralis is actually represented by the same organism. It can be human, cats, dogs, pigs, rats, and other animals. Typically, infection of Trichinella spiralis occurs due to the eating of meat of the animal that is infected with Trichinella spiralis larvae. Then, larvae will appear inside of the intestine of the patient, and there it will be transformed into the adult worm during approximately 30 hours. Lifespan of the parasite of the adult worm is 40 to 50 days. Adult worm will give rise to a larva that will migrate from the intestine through blood circulation not into the lungs but into the muscles. Typically, muscles that are affected are tongue, chewing muscles, deltoid muscles, intercostal muscles, pectoral muscles, diaphragm. 4 weeks after arrival into the muscles, capsule may be formed around the larva, and inside of the muscles encapsulated larva may survive for 25 years. Pathogenicity of Trichinella spiralis. From the site of intestine, clinical symptoms may be represented by nausea, vomiting, diarrhea, abdominal pain. Another group of symptoms is associated with larva infection of the muscle, and these symptoms may be represented by headache, muscle ache, fever, face edema. Also, in case of infection of Trichinella spiralis, may appear skin rash, allergic vasculitis, and toxic allergic damage of internal organs. In order to diagnose Trichinella spiralis, could be done microscopic examination of muscular biopsy to find the larva, and also identification of antibodies in the blood against Trichinella spiralis. Another option is to make X-ray examination to identify calcified and encapsulated larvae. It is important to note that Trichinella spiralis unfortunately resistant during usual cooking of the meat, and that is why meat quality control should be routinely done by qualified personnel on the markets. And now let's speak about Dracunculus medinensis, or Guinea worm. Its geographical distribution includes tropical Africa, Middle East, Iraq, Iran, India, Pakistan. This is a schematic illustration of the female of Dracunculus medinensis, and you may see that this is quite long parasite that may reach 120 centimeters. At the same time, male worm is quite short. Definitive host of Dracunculus medinensis is human, while intermediate host of this parasite is freshwater crustaceans cyclops. Name of this disease is quite tricky. It is called Dracunculiasis. So let's imagine that this is a water, and inside of this water we see cyclop with immature form of Dracunculus medinensis. Infection occurs during drinking water with infected cyclops. And then larvae will be transferred into gastrointestinal system, and from there it will migrate into connective tissue. Inside of the connective tissue, larvae of Dracunculus medinensis will be transformed into an adult worm, and this may take 3 to 4 months. What this parasite will do next? Next, it will migrate under the skin, typically to the legs, because there is a higher probability for further contact with water. When parasite will reach its final destination in the legs, under the skin, it will release toxins, and this toxin will cause a blister on the skin. Then blister will break and form an ulcer. But this ulcer will also include a head of the worm in the base. So this will be not simple ulcer, but ulcer with the worm inside. But not the whole worm, but just tiny portion of this worm. Why parasite is doing this? Because if then infected person will come in contact with the water and parasite will appear in contact with the water, it will start to release larvae. During contact with water, parasite will release a lot of larvae, and then this larvae will have possibility to find next cyclop to repeat the whole life cycle. Pathogenicity of Dracunculus medinensis associated with allergy, toxic damage, and mechanical injury. Clinical symptoms may be represented by ulcer, also urticarial rash, also arthritis, in some cases nausea and vomiting. In order to diagnose this pathology, usually performed identification of the worm under the skin and identification of the antibodies in blood also can be used. Here you may see how parasite is extracted from the patient, and this is done slowly rolling the worm on a small stick for several centimeters per day, and this may take a long time to roll out all this parasite from the patient. In order to prevent, it is important to make boiling or filtration of the water. Also, it is important to treat infected people and destruct cyclops in the water reservoirs. I hope that with this video lecture, topic of nematodes and life cycles of the parasites that we have discussed recently becomes more clear for you.